Good morning, friends. Today we are going to talk about hip joint. Hip joint is one of the biggest joint of our body, and this is weight-bearing joint and also going to help in the movement. And this joint has so many important aspects that we have to discuss this in detail. First of all, we should know where it is. So, hip joint is the articulation of the femur with acetabulum of the pelvis. So, in the hip bone on the posterior side, there is the acetabulum, and femur is the bone of thigh region. So, they are going to make contact and they are going to form the joint. Why this joint is so important? Because as you can see here, it is a transition point between the upper and the lower portion of the body and is therefore crucial in most of our everyday movements. It is closely tied with sacroiliac joint biomechanically. मतलब यहाँ पे जो जॉइंट है ये जॉइंट अपर लिम्ब और लोअर लिम्ब और ट्रंक स्पेशली ट्रंक और लोअर लिम्ब को कनेक्ट करता है और ये हमारे मूवमेंट में बहुत हेल्पफुल है. दैट्स व्हाई दिस जॉइंट इज सो मच इम्पोर्टेंट. Let's see its anatomical relations. First of all, how the joint is constructed. So first there is pelvic bone and sacrum and then femur and pelvis. The pelvic bone and sacrum, if you see, you can see the video, small video is coming up in the side. You can see again, both pelvic bones are joining in the front with the joint pubic symphysis, and on the back side sacrum is joining with sacroiliac joints like this. So two pelvic bones are joined at pubic symphysis. The sacrum is joined as the pelvis at the sacroiliac joint. So this is how pelvis bone and sacrum are going to complete the pelvic cavity, you can say. Then there are femur bones and they are going to come and join with the acetabulum of the pelvic bones. The head of femur fits into the acetabulum at the oblique angle and is curved by the bony structures and labrum to create a mobile but relatively stable joint. तो दिस इज द स्टेबल जॉइंट. जैसे स्टेबिलिटी बढ़ता है तो मूवमेंट कम हो जाता है. सम मूवमेंट्स आर गोइंग टू बी restricted here. It will be not fully flowing just like our shoulder joint, though it is also a synovial joint of ball and socket variety. Again, you can see how this joint has been formed. Now, to stable this joint, we need something to make this, to restrict some movements actually. So first of all, this has been done by the angle of femoral neck. The angle of femoral neck, as you can see, it is not a straight angle or just an angle. It is angle has some inclination, and this inclination is 120 to 126 degree. The angle formed by the neck and shaft is called angle of inclination. So as the age is going to grow, as we are going to become old, this causes the force from upper body to shear more strongly through the neck of the femur. Thus, the angle is disturbed and fractures can be more commonly involved in old age. Then there is one more angle, angle of torsion. This is angle of torsion. As you can see, the neck of femur is angled 12 to 15 degree out of frontal plane, that is from the axis of femoral condyles. So this angle is angle of torsion, that is 12 to 15 angles. So it is actually large dorsal angle is called anteversion, whereas the actually small one will be called as retroversion. अगर angle बढ़ गया तो anteversion, घट गया तो retroversion. And this angle is between the angle of neck of femur to frontal plane, that is axis of femoral condyle. As you can see in the diagram, this part, this is condyle, and this you can see the angle is 12 to 15 degree. So these two degrees angles are going to show you about the stability factor, and these are some biomechanical part which is on the base of the femoral neck. Next again, we can see next thing, acetabular labrum. Acetabular labrum is just like a rim like of thing which is going to help in the connection of neck or head with acetabulum, like there was glenoid labrum in shoulder joint. So acetabular labrum, as you can see, this part is acetabular labrum. So this is head of femur, this is acetabulum, this is ligament of head of femur, and this is going to form in the labrum. What is the purpose of labrum? To increase the depth of the acetabulum. Already it is having some depth. This is like, if this is my acetabulum, this is how the head is going to be fit designed. But to give more access, more depth, labrum is also present. That is acetabulum. So this is made of dense cartilage tissues, and does it, but there is one catch that it doesn't surround all of the things. So there is a gap in the medial aspect of acetabulum which instead bridged by the transverse acetabulum ligament. There is one transverse acetabular ligament which is going to fill that gap, which is present in the medial aspect of the acetabulum. So this was the factor number 2 to provide the acetability. That is, first was angulofemoral neck, then acetabular labrum. Now comes the covering, that is joint capsule. So in joint capsule, you are going to see three things, just as the name of the part of hip, sorry, hip bone, yes, and their connection with the femoral. So it is an envelope of ligamentous tissue that encases the hip joint to add stability, containing the synovial fluid because this is a synovial joint. The first is iliofemoral. It prevents the hyperextension of the hip. Iliofemoral means starting from the ilium going to the femur, and this is going to help in the prevention of hyperextension. Then there is pubofemoral. This is also going to help in the prevention of excess of abduction. And then there is ischiofemoral. It is actually on the back side. So I will show you the different view. So if you want to see ischiofemoral, you have to go back side, and from back you can see. So this widens the tighter as the hip moves from the flexion into extension, pulling the femoral head more securely into the acetabulum. So this is from the posterior side. So these ligaments are actually going to help in the stability of the joint with the joint capsule. Next in the stability factor was the bursa. Bursa are the things which are present to decrease the frictions. So these are located actually at high friction point between the moving tissue. There are three number actually you can see here, and they are fluid filled sac which are important for the mechanical function of hip joint. So you can say iliopectineal bursa. It reduces the friction between the anterior surface of hip joint and iliopsoas. तो एक मसल का टेंडन होगा और एक बोन होगा, उसके बीच में ये होगा, तो ये नाम से पता चल जाएगा आपको कि कौन से वर्षा का हम बात करें या कहाँ है ये. That is iliopectineal. Then trochanteric bursa. It buffers the friction between the greater trochanter of femur and gluteus medius and minimus and TFL, that is tensor fascia lata. The muscles are already been described in one of the previous lectures. You can see the muscles of hip and thigh, and you can revise them. Ischiogluteal bursa, important for reducing the friction between the deep fibers of gluteus maximus and ischium of the pelvis. So these are some factors which are actually going to help in the stability. Again, we can recall that first was the angle of femoral neck. There were two angles, angle of inclination and dorsal angle. Then there was acetabular labrum. Then joint capsule having three ligaments, and then three bursa which are going to help it out. So next we have to move to the